Trauma is widespread, affecting every socioeconomic group. It is almost a universal experience of people with mental and substance abuse disorders. Individuals with experiences of trauma are found in many service sectors, including the justice, child welfare, school, employment, and healthcare systems. Addressing trauma is an important component of behavioral health and requires a multi-sector understanding of its far-reaching effects in order to make a difference and foster well-being in our society. Upon completing this course, you will be able to realize the impact of trauma on individuals, groups, and communities. Recognize signs and symptoms of trauma in individuals. Describe components necessary for recovery from trauma. Identify methods to prevent re-traumatization. Lesson 1 provides the course rationale, goals, and outline, presents a definition of trauma, and discusses its prevalence. Lesson 2 describes trauma-informed care and its connection to person-centered care. Lesson 3 reviews some types of trauma and behavioral signs that may indicate past trauma. Finally, Lesson 4 describes a trauma-informed approach to care, which is necessary to meet federal regulatory standards of care. Individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Although many people who experience a traumatic event or events are resilient and can go on with their lives without lasting negative effects, many have difficulty coping and demonstrate protective strategies when they are faced with triggers or memories of the event. Those who cope well may have had caring, supportive relationships that helped them recover. Research shows that trauma disrupts central nervous system development, impairs immune system responses, and often results in chronic physical or behavioral health disorders. Trauma, especially repeated trauma, can overwhelm a person's ability to cope. People who have experienced trauma often feel vulnerable, helpless, and afraid. Trauma effects may cause challenges with relationships, beliefs about oneself and others, and how one fits into the world. The first national comorbidity study established just how prevalent traumas were in the lives of the general population. 61% of men and 51% of women experienced at least one episode of trauma in their lives. In a landmark study of adverse childhood experiences, ACE, by the Centers for Disease Control and Prevention, CDC, and Kaiser Permanente in 2013, the associations between childhood maltreatment and later life health and well-being were studied. Almost 2/3 of the study participants reported at least one adverse childhood experience, and more than 1 in 5 reported 3 or more adverse childhood experiences. Adverse childhood experiences have been linked to risky health behaviors, chronic health conditions, low life potential, early death. Trauma can be the result of an adverse childhood experience such as family dysfunction, parental separation or divorce, abuse, neglect, or other trauma. We are reminded almost daily of community and cultural traumas when the evening news reports a string of robberies, gang killings, hate crimes, mass shootings, and workplace violence. Even people you work with may be affected by trauma, such as domestic violence within their family, or they may live with hatred related to their cultural group. We never know what might have happened to an individual we are caring for or working with if we judge their behavior without appreciating that there may be a relevant cause. Healthcare workers who are trauma-informed have knowledge and understanding of trauma and its far-reaching effects. Select the answer that best fits the question. Regarding trauma, which of the following statements is false? A. Trauma is experienced by an individual as physically or emotionally harmful or life-threatening. B. Coworkers may suffer from the effects of trauma. C. Healthcare workers who are trauma-informed have knowledge and understanding of trauma and its far-reaching effects. D. People don't recover from repeated trauma, so medications must always be prescribed to treat adverse behaviors. When individuals have caring, supportive relationships, they can recover. Trauma-informed individuals strive to understand trauma and its far-reaching effects in an effort to help others heal and recover. Person-centered care considers the needs and preferences of an individual. This includes cultural needs, care preferences, and an individual's past life experiences. Life experiences, good or bad, have an impact on who individuals are and how they respond to people and their environment. Trauma-informed care providers display a sensitivity to a person's past traumatic experiences and try to understand how they relate to their health status and health-related behaviors, while providing interventions that support an individual's healing. A sensitive care provider recognizes that some individuals may use drugs or alcohol to mentally survive a past trauma. This sensitivity enables providers to more effectively help an individual. Individuals are not blamed for their behavior. Instead, attempts are made to understand the individual. Healthcare providers kindly ask, "What happened in your life?" conveying a message of sincere concern as they avoid labeling. This sets the stage for therapeutic and positive relationship building and makes the person feel as if his or her life matters. Trauma-informed care is empathetic, thoughtful, tolerant, and sincerely demonstrates an intention to understand. A compassionate caregiver can help trauma victims adapt, cope, and even thrive despite what happened to them in the past. Quality of care is contingent upon getting to know a person by initiating and maintaining a therapeutic relationship. The purpose of the relationship is to preserve a person's identity, autonomy, and quality of life. It involves learning about a person's life history, their values and beliefs, routines, likes and dislikes, and everything that makes them unique, with care provided in an environment that is familiar and comfortable. A therapeutic relationship supports choices and gives people a sense of control by encouraging them to participate in their care. Links a person's interests and strengths to activities that provide fulfillment and satisfaction. This is person-centeredness and is a central theme in the regulations of the Centers for Medicare and Medicaid Services, CMS. This approach to care demands continuous listening and assessing response to planned interventions in order to individualize care and create a supportive, comfortable, and safe environment. Trauma can make individuals feel unsafe and strip them of their power. They may feel helpless, ashamed, and unable to share their experience, especially if they were silenced because they were threatened. When trauma happens to an individual, that person may turn inward. He or she may be afraid to talk about the experience unless asked, and even then may speak only if they feel safe sharing it. Trauma in childhood can result from physical, sexual, and/or emotional abuse, poverty, discrimination, parental separation or divorce, serious illness, negative experience in the healthcare setting, being a victim of human trafficking, many other reasons. Some examples of trauma that might occur in an adult's life include life-threatening illness, sexual assault, domestic abuse, multiple losses. Trauma can also occur within groups. The response dynamics of first responders and military personnel deployed to war zones are somewhat unique. They share a common identity and experiences. In fact, given their work, these groups are at a greater risk of experiencing trauma and often experience repeated trauma. They tend to keep the trauma experiences within the group because they may feel others may not understand. The group may even encourage repression of feelings, and survivors may shut down emotionally. If an individual seeks help, it may be viewed as shameful by the group. Some people develop traumatic stress symptoms associated with mental and substance abuse disorders. Trauma may happen to larger groups of people, affecting the whole community. In a large group, the community or culture within the community feels unsafe and threatened. Support systems often immediately reach out to individuals and intervene to offer help after the trauma. Affected individuals do not have to reach out for support, and the trauma is a shared event. It is public knowledge and reported in the media. Examples of group trauma within a community may include physical or sexual assaults, workplace violence, hate crimes, robberies, gang-related violence such as shootings or stabbings, threats, terrorism, shootings, cultural indifference, limited responsiveness to cultures facing a catastrophe. Although group trauma is initially well supported, certain individuals can have lasting negative effects from the experience. Support can wane over time, so unresolved experiences may persist, especially with repeated trauma. Other traumatic events to be aware of include mass trauma, where the event may spawn even more trauma, natural and human-caused disasters, earthquakes, hurricanes, a nuclear reactor meltdown, a tsunami, interpersonal traumas, intimate partner violence, political terror and war, refugees who have been persecuted or tortured, re-traumatization. Unknowingly, healthcare workers can create re-traumatizing experiences, triggering a stress reaction in individuals. Organizations that anticipate resident needs and have taken time to screen for a history of trauma use this information to design a plan of care that achieves better results. When screening is not done, a traumatic history can go unnoticed until an individual displays adverse behaviors. If the cause is not recognized, treatment plans may include inappropriate use of medications or other measures to suppress behaviors. Recognize that repeated trauma wears down a person's resilience and prevents adaptation. The following actions by healthcare workers can set the scene for re-traumatization. Failing to screen for trauma history prior to planning treatment. Discounting or challenging reports of abuse or other trauma. Using restraints or seclusion inappropriately. Not providing a peaceful and safe home environment, for example, making or permitting loud noises that may startle someone. Performing invasive procedures without an explanation. Humiliating a resident. Confronting a resident. Not intervening when abuse occurs between residents. Labeling and judging behaviors as pathological. Limiting a resident's engagement in his or her care. Minimizing, discrediting, or ignoring resident responses. Disrupting schedules and allowing inconsistency. Not allowing clients to question policies and procedures. not providing privacy during urine collection or undressing, enforcing new restrictions without staff-client communication, allowing agency dysfunction and incompetent management. Many people exposed to trauma do not have symptoms. Those who experience repeated, chronic, or multiple traumas are more likely to exhibit pronounced symptoms and experience negative consequences, including substance use disorders, mental illness, and physical health problems. Residents should be screened and assessed for trauma during the admission process, but be aware that some residents or their families may not disclose traumatic events initially. Signs that trauma may have occurred may appear later as behaviors and responses are observed during care. If a resident displays some of the following signs, it may indicate a past experience of trauma. Further evaluation and follow-up is indicated either by a skilled agency counselor trained in trauma care or through referral to an outside source. Fear, anger, or sadness. Hyperarousal or feeling on edge. Quick to anger or irritable. Difficulty concentrating. Hypervigilance. Disturbed sleep or nightmares. Flashbacks, uncontrollable images and memories of the trauma. Distressing thoughts and feelings about the trauma. Physical symptoms of anxiety, such as a racing heart, upset stomach, or headaches. Risky or impulsive behaviors. Distracted behavior. Direct caregivers, such as nursing aides or other workers, must report changes in behavior immediately so that the cause can be appropriately addressed and interventions to modify the environment and interactions can be implemented. Recognize that behaviors from unresolved traumatic events are coping mechanisms. Minimization, dissociation, and avoidance are common defenses for many trauma survivors. Memories of the event can be distorted to avoid the painful effects of the trauma. Some survivors cope by never talking about their traumatic event, and they are able to move on with their lives, performing needed activities, regulating their emotions, sustaining self-esteem, and maintaining and enjoying relationships. Trauma is prevalent in our society. While some people are resilient and can lead productive and fulfilling lives after trauma, others cannot. It is important to recognize that trauma responses are coping mechanisms. Given a safe environment and therapeutic relationships, trauma survivors can achieve psychosocial and emotional well-being. Furthermore, a trauma-informed approach is a requirement for participation for long-term care facilities, addressed in Section 483.25M. Facilities must identify, address, and/or obtain necessary services for the behavioral health needs of residents. Learn the resident's history and prior level of functioning in order to identify appropriate goals and interventions. Learn about each individual's responses to stressors and utilize person-centered interventions developed by an interdisciplinary team. Identify needs in the comprehensive assessment and develop and implement person-centered care plans. Individualized interventions must relate to the diagnosed conditions, and if necessary, residents should have access to needed community services, such as substance abuse programs. If care plans are not effective, or if there is a change in condition, they should be revised. Research has indicated that with appropriate supports and intervention, people can overcome traumatic experiences. Organizations that are trauma-informed recognize that everyone has a role to play in helping others heal, beginning with the initial greeting by the receptionist upon admission to the direct care providers and administrative staff. Interventions and principles suggested on the following slides demonstrate application of person-centeredness and respect for every human being, regardless of who they are: client, resident, patient, coworker, or facility administrator. Promote safety. Create an environment that is physically safe and where individuals feel emotionally safe to share information about themselves, including their perspectives and opinions. Eliminate trauma triggers or reminders of the traumatic event, such as harsh lighting or other sensory stimuli, smells or sounds. Avoid situations that might mirror a person's traumatic experience. Earn trust and be transparent. Provide full and accurate information about what is happening or changing so that people understand the reason behind an action and can trust decisions that are made. Encourage therapeutic relationships through collaboration and mutual support. Trauma survivors may benefit from peer support in a setting that promotes safety and hope. Allow for shared stories and ideas that foster self-worth and promote recovery and healing. Recognize a person's strengths. Promote shared decision-making. Individuals should have input into their plan of care. After all, they know what has worked and what has not worked to help them adapt to the trauma's aftermath. Staff should feel free to share their perspectives and suggestions. Be consistent and follow through on what was agreed upon. Make sure the resident and everyone on the team knows the plan. For example, always knock on the door and request permission to enter someone's room. Empower people. Help them to know that they matter in this world. They are important and they can contribute. Involve individuals in activities that help them feel worth and connectedness to others. Build upon their strengths. Accept and appreciate diversity. Cultural connections can help unify relationships and help healing. Recognize that every human being is looking for value and connection in this life. In conclusion, organizations are required to incorporate current knowledge about trauma management into their policies and procedures. Services provided are required to be culturally competent and trauma-informed, Section 483.21b3, and be delivered by individuals who have the skills, experience, and knowledge to care for these residents. You have completed the course on trauma-informed care, helping traumatized individuals achieve well-being. In this course, you have reviewed the impact of trauma on individuals, groups, and communities, signs and symptoms of trauma in individuals, components necessary for recovery from trauma, methods to prevent re-traumatization.